Hi everyone, hopefully you can hear me okay. We're still waiting for people to join, so we'll just give it a minute or so. Okay, so we'll make a start. We might have some more people to join as we go along, but I'm conscious of the time, so we'll crack on. Welcome everyone to our Ask a Dietitian session. Thank you so much for coming today or this evening. I hope you find the session helpful. I'm sure you will. My name is Nicci and I am one of the specialist nurses on the support line here at Pancreatic Cancer UK. And I'm really pleased to be joined today by Rachel and Lauren, who I will introduce fully in a moment. But first of all, I just wanted to let you know how the session is going to run this evening. So for the first 20 minutes or so, I'm going to be asking Lauren and Rachel some of the most commonly asked questions that we hear on the support line with regards to diet and nutrition. And then the second part of the session, I'll be asking the questions that you put forward yourselves. So please be adding your questions into the Q&A box that you should see at the bottom of your screen as we go along. We would encourage you to ask any questions that you have about pancreatic cancer and nutrition, and of course, pancreatic enzymes. And I just wanted to touch on the current supply issue of the enzymes. So as a charity, we are well aware of the issues around accessing pancreatic enzymes at this time. And we know that it is a big problem for lots of people around the country. Because we only have a limited amount of time this evening, we won't be able to answer individual questions around the current shortage of enzymes, but we do have lots more details on our website regarding this, and we can pop the link into the chat so you can see how to access that. And you can also call our support line phone number. Again, the details will be in the chat. So if you are having issues getting your prescriptions filled for pancreatic enzymes, we're more than happy to discuss this with you on the support line. Just an update, as far as we're currently aware, the 25,000 units of Creon should now be back in stock, although the 10,000 units remain in short supply. Said, please do get in touch with us on the support line if you need any further guidance regarding that. Okay, so we're keen to get what you would like to get out of this session, so please pop any comments in the chat. We don't have an awful lot of time together today, so again, a reminder that our support doesn't stop here. As well as contacting the nurse support line, you can also find lots of information, including free publications which you can download or order paper copies to be sent free of charge, and you can find all that information on our website. So without further ado, I'm delighted to introduce to you now Lauren Roberts, who is the Pancreatic Lead Oncology Dietitian for the Clatterbridge Centre in Liverpool, and Rachel Caddy, who is a specialist pancreatic dietitian working with people affected by pancreatic cancer at the Liverpool University Foundation Trust. So welcome to you both, and thank you so much for coming along this evening.
Thanks, Nicci.
Thank you.
So we're going to start by asking some background questions, really, to kind of set the scene for what we're going to cover this evening. So my first question is, can you just explain a little bit about what the pancreas does?
Yeah, so the pancreas is something that we don't often think about that much until something goes wrong, sadly. So the pancreas is a gland that sits behind the stomach. It's about 6 inches long, and it's kind of got three kind of distinct sections: the head, the body, and the tail. Now, the pancreas has got two important jobs. One of the jobs is to help us to digest our food properly. And the way it does this is by making something called digestive enzymes and other digestive juices. And what those enzymes do is they mix with our food, which travels from our stomach to our intestine. And in the intestine, those digestive juices and those enzymes, they mix together with the food to help break it down into tiny pieces so the rest of the bowel can absorb all the nutrients from that food. Those nutrients then can be used for energy for our body. So that's one of the jobs of the pancreas. The other job of the pancreas is to help us control our blood glucose levels. And it does this by making hormones, insulin, which people may have heard of, and glucagon, which work together to manage your blood glucose levels. Now, we can live with part of the pancreas removed, all of the pancreas removed, but depending on which part has been taken away will affect which function. So if somebody has a surgery, for example, that takes away the head of the pancreas, that would mostly affect the digestive aspect of the pancreas function. Whereas if somebody has the tail end of the pancreas removed, that might affect their blood glucose management. And if somebody has all of the pancreas removed, then that will affect both of those functions.
Great. Thank you, Rachel. And it's so true what you said. Until you need to know what the pancreas does, it's not an organ that we know an awful lot about, is it? Until it starts to cause problems. So in terms of dietary issues, what kinds of problems do people with pancreatic cancer often have in your experience?
So what we tend to see is initially people tell us that they have these kind of very vague symptoms that kind of affect how well they're able to eat. So things like kind of bloating or nausea or abdominal pain when they're eating. And they're very non-specific, but as a result, people will either adjust what they're eating or adjust how much they're able to eat. And what we might see is that people will lose weight as a result of these adjustments. And that's true because we know that up to 80% of people with pancreatic cancer have some weight loss at the start of their journey. So what we tend to see is people might cut out certain foods. So this is one of the main challenges of pancreatic cancer and its side effects. One of those jobs, as we talked about, of the pancreas is to help with the digestion of our food. If somebody's not digesting their foods well, what we can see is that they have certain side effects like pale, oily stools that can be very greasy and oily. And what people tend to do to try and stop this from happening is they cut out fatty foods. And what we see is that their symptoms of those kind of greasy, oily stools, they actually reduce. But as a result of cutting out those fatty foods, what we see is that people lose weight very, very quickly and they can get malnourished very quickly. So what we see then is that people who've already had some weight loss, they carry on losing weight very, very quickly. And we talk a lot about weight, but really what we mean is strength when we talk about weight. Because when someone's losing weight very quickly, they don't tend to lose fat weight, they tend to lose muscle weight. And this affects how strong somebody is, but also can affect how well they're able to tolerate certain treatments. So things like oncology treatments or whether somebody might be fit for surgery or not. So this kind of ongoing weight loss can be a real challenge for people who are affected by pancreatic cancer. What we also see as kind of part of the dietary challenges that come for people with pancreatic cancer is that they might have developed diabetes at some point during the course of their journey. And this again can be quite challenging because people will again adjust what they're eating to try and manage their blood glucose levels, and as a result they might pull back a lot on things like portion sizes or certain types of food. And again, it's this cutting out of food groups that means that people are more at risk of dropping their weight very, very quickly. So what we try and do is manage those types of symptoms. So we can manage malabsorption, we can manage diabetes with certain medications, and that can actually help to address those types of dietary problems. But it's not just that we tend to see, you know, it's side effects of other things. So side effects of things like cancer treatments, you know, people may be getting sore mouths, they may be having nausea, vomiting, diarrhea, constipation, a whole host of side effects. And all of these things can really, really affect appetite and can affect how well someone's able to eat as a result. In addition to those kind of I guess, physiological aspects of dietary problems, we also see the other side of it. So things like the psychological impact of cancer on eating. You know, if someone's really, really anxious, this can really affect their appetite, so they don't eat as well. You know, things like pain relief, that can really affect how well somebody wants to be able or is able to eat, or the desire to eat. And again, well-meaning family, friends, loved ones, that can affect how well someone's able to eat, because often food is something that is so, I guess, normal for a lot of people, and it's something that we need to do. And often people can view this as a thing of, oh, this is how I can help. And sometimes, even though it's usually well-meaning, it can add an extra layer of pressure on people who already have a huge amount to deal with. So there's a whole host of things that people with pancreatic cancer have to kind of deal with from the dietary aspect.
Yeah, absolutely. Gosh, it just highlights, doesn't it, how complex an issue it is. And it's not just one thing that causes those issues, but often a combination of lots of different factors.
And they all interlink, and it can make it really, really tough for people.
Thanks, Rachel. Okay, so we can't hold a session around nutrition and diet without talking about PERT, so pancreatic enzyme replacement therapy. Lots of you will probably hear it known as Creon, which is the brand name, or Nutrizine, which is another brand that sometimes people are prescribed. So can you tell me a little bit about what PERT is and why it is so important for people with pancreatic cancer?
Yeah, so I can talk about this one, Nicci. So I think Rachel summarised beautifully, the role of the pancreas and how it works with digestion of our food. So, in individuals with pancreatic cancer, either the pancreas is not producing enough of our digestive enzymes and juices to sort of help break down our carbohydrates, our fat, and our proteins for our body's needs. And that might be because the tissue of the pancreas is damaged because of the cancer itself. Or, as Rachel has said, these enzymes and juices may not get to where they need to be in the small bowel to mix with the food, so they're digested and broken down for the body to absorb them better. And this can happen in, pancreas surgery, so head of pancreas surgery, cancer, for instance, or there might be a tumour in the head of the pancreas that can't be removed by surgery. So pancreatic enzyme replacement therapy, then also known as PERT, you might hear that quite often, is so they are replacement enzymes, if you like, that we would prescribe to you, usually in capsule form. And as Nicci has said, the most common one being Creon, but we also have Nutrizine as well. So these are essentially doing the job of the pancreas when it comes to digestion. So you would take these capsules usually with your meals, with your snacks, with any supplement drinks that you're taking or any milky drinks that you're taking. And then we would monitor symptoms and titrate upwards if we needed to.
Sorry, Lauren. Sorry to interrupt. Can you just explain what you mean by titrate?
Yeah, so titration, so increasing doses in summary. So we would increase doses depending on symptoms. So starting doses usually, we would go with sort of 2 to 3 capsules of Creon or Nutrizine with a meal. And then with snacks, we would go with between 1 and 2. And if that's not having the desired effect, so if you're still getting, sort of gut symptoms and symptoms of you're not digesting and absorbing your food properly, then we would be looking at increasing those doses. And in practice, they are sort of starting doses, and we do need to increase much higher with patients in clinics as well. So why are enzymes important? So Rachel again has summarized this quite well. So obviously, if you're not digesting and absorbing your food properly, you can end up with lots of sort of gut symptoms. So that's diarrhea. So what I mean by that is those pale, greasy, oily looking stools that may be floating. You may get lots of wind and bloating, which can be quite debilitating for people as well and affect sort of quality of life. And you may also get weight loss. So if you're not digesting and absorbing your food properly, this can then result in weight loss, which then can lead to malnutrition. And Rachel again has touched on the impact that malnutrition and weight loss can have on individuals. So it can, impact on how well you tolerate treatment. So that could be oncology treatment such as chemotherapy or radiotherapy, or your surgery. We tend to know that people that are sort of better nourished or well nourished tend to do better overall with their treatment regimes when they come to us in oncology, and tend to have sort of less delays with their treatment as well. And overall, if you're well nourished, you tend to feel better in yourself, you tend to feel stronger, have that better well-being and better quality of life overall as well.
Thanks, Lauren. That's really helpful to look at PERT and get a clear picture of exactly what it does and why it's so key, because we know it really is so important for people who need the enzymes to take them. Okay, so next question. I was just thinking about the kind of foods. We often get people who call the support line asking us if there's certain foods that they should be eating or if there's certain foods that they should avoid.
Yeah, no, good question. And we get asked this quite a lot in clinics and in this setting. So, I mean, in summary, there are no foods, at all that you need to avoid with pancreatic cancer. As Rachel has mentioned as well, sometimes you may struggle or think you're struggling with certain food groups such as fat, and then as a result start to cut back on those fattier foods to try and sort of get a hold of symptoms really. But actually sometimes that gives us a bit of a clue that you might actually need more pancreatic enzymes in that case to cope with the amount of fat that you're eating. And a lot of patients will report sort of a resolution of symptoms once they've increased their enzymes with those fattier meals and foods. So, you may find as part of your diagnosis and treatment path that you are struggling with your appetite and eating. We would encourage you to include sort of all food groups really. So that being our carbohydrates, fats and proteins as part of meals. When you're looking at a meal, we would want you to be making it as calorie rich and as protein rich as possible. And going for sort of full fat products again to get the most calories where you can out of those meals. We look at, and often we'll do sort of food fortification advice and strategy. So that is adding extra calories and protein again to your meals to make the most out of what you're eating and make them as rich as possible. And that's quite useful where you're struggling with big portions and only managing small meals. So we're really enriching that meal to make the most out of it. Adopting a sort of little and often approach if you're struggling as well can be quite useful. So where you may have been always a sort of 3 meal a day sort of individual, it might be better to strip that back a little bit and go for 5 to 6 smaller portioned meals and snacks per day as well. And that can be sort of less overwhelming at times for people as well, as we often find patients say that they're easily overwhelmed at meal times. So yeah, it's really important that you keep your strength up as much as you can, and diet is obviously one way to do that, and that will help you, depending on the treatment that you're having as well. Yeah. And I think we find especially with oncology treatment, your sort of taste and appetite will change quite often through the course as well. So foods that you may not have enjoyed particularly or been a fan of before diagnosis or at the start, you might find that changes and you start liking those types of foods and you go off foods that you've always been a lover of really. So it's important to keep trying with different foods as much as you can. Yeah,
that's great advice. Thanks, Lauren. And just to ask about the fortifying foods, would that be then adding things like butter into mashed potato or adding cream into soup?
So usually we would fortify. So usually we would fortify foods using your fats, sort of dairy products really. So it might be cream, So adding cream into soup, for instance, or a little bit extra full fat milk and cheese to mashed potato. It might be adding extra sort of spreads to sort of bread, or crackers, that sort of thing. Yeah.
Perfect. It's a good way, isn't it, to sneak in those extra calories without perhaps feeling so overfaced by a big plate of food, which we know is really off-putting. Thanks, Lauren. Something also that we get asked a fair bit when people contact us is, I haven't been referred to a dietitian. Should I have been?
Thanks, Nicci. So, I mean, ideally, yes. So as part of the kind of optimal care pathway for people with pancreatic cancer, everyone should ideally be referred to a specialist dietitian, and they can give you tailored dietetic support. But it's in reality, it's a little bit of a postcode lottery in that some areas do have specialist dietitians that will cover pancreatic cancer patients, and there's some areas that don't have that specialist service, sadly.
Mm-hmm.
So what a dietitian would do is, when you speak with them, is talk to you about making sure that you're taking your pancreatic enzymes in the right way, and make sure that you're armed with the knowledge to know if you need to take more or less with certain things. And that is to make sure that they're working effectively, to make sure that you can maintain your strength for as long as possible. What we'd also do is discuss kind of aims of what the dietetic input is trying to achieve. So this can look different for lots of different people. So if somebody is having pancreatic surgery for a cancer, their aims of dietitian input would be to build strength and to help them to tolerate the surgery better. But that aim would be very different to somebody who is not having a surgery and is having supportive care in the community, where quality of life is the most important aspect. So it really depends on what the treatment is as to what the dietitian will speak with you about. And as Lauren has just talked about, often dietitians will speak a lot about including kind of higher calorie, higher fat foods into your diet, and having the specialist dietitian there, we would help to kind of tailor that type of advice with an aim of kind of maintaining your strength and your quality of life for as long as possible. Also, we'd maybe speak about things like oral nutritional supplement drinks, and the best types of these that would be best for you, to try and maintain your strength for as long as possible. Or if you're an inpatient, if you need a bit of extra support nutritionally, it might be that we speak about things like feeding tubes for a period. So that's essentially what a dietitian would do, and support you throughout your journey and throughout your oncology treatment as well. Now, we are aware that some people don't get the opportunity to speak with a specialist dietitian, and if you are seeking out information, attending sessions like this, but also using those kind of reputable websites, things like Pancreatic Cancer UK, using things like the NHS websites to gain information on how you can maintain your strength for as long as possible.
That's great. Thank you, Rachel. And yeah, like you say, sessions like this are so important, especially if you don't have that specialist dietary input. So thank you so much again for coming along and answering lots of these questions. Next question. What can I do if I struggle to eat because I feel sick or I'm not hungry?
Yeah, so this is another common one we come across, on a daily basis, really. I'm feeling sick, or, nauseous, as we often know it by, and sort of lacking appetite as a result of very common complaints in individuals with pancreatic cancer. And it may be you feel sick for, a range of reasons. It may be post-surgery, that you experience that sick feeling, or if you're going through sort of chemotherapy treatments, for instance, that's quite common as well. And anxiety, and worry can make you feel a little bit sort of off and sick and nauseous as well, with sort of the unknown. So what I would say is, and it's important that you are prescribed an anti-sickness as a first step, really. So you can speak to, your specialist team about getting one prescribed if you're not already on one. And it's important that you make sure you're taking those anti-sickness medications at regular intervals. What I would say is, the one that that might be prescribed might not be doing the job for you. So if you don't feel it is, then please speak with your team about getting an alternative to try instead. One doesn't fit all, and there are some anti-sickness that work by sort of pushing food through the gut a little bit quicker as well, so can help with those symptoms of feeling sort of full and bloated as well, really. So from a diet sort of perspective and strategies you could try if you are feeling sick. So again, we would be going for that little and often approach, those small frequent snacky meals throughout the day. What we would say is, if there's a time of the day where you feel your appetite is best, then make the most out of this as well. So if you feel your appetite improves as the day goes on, then obviously try and have your biggest meal and your most calorie dense meal at this time. Some people find that getting a little bit of fresh air or having a little walk before they sit down and eat as well can sometimes help stimulate appetite a little bit and take that edge off of sort of the nausea. So that might be something to try. And also keeping away from sort of the kitchen and cooking smells as well. Often those smells aggravate nausea and make that feeling of sickness a little bit worse. We could try colder foods. So a lot of people say that they find colder foods better tolerated when they're feeling a bit nauseous. And again, I think that's related, isn't it, to sort of less smells and odours they carry as well. So you could try things like cheese and crackers, or toast and sort of peanut butter, or with a full fat spread on, sort of milky puddings like yogurts, trifles, cheesecakes, that sort of thing. And going back to that old myth about ginger as well, so it works for some people, doesn't work for all, but there is a little bit of evidence around ginger helping with nausea. So you could try nibbling on a few ginger biscuits when you wake up, or opting for sort of a ginger drink as well. That can sometimes help. And on sort of the topic of drinks, sometimes, not with everybody, but sometimes fizzy drinks can just take the edge away, often sort of an off feeling stomach as well. So that might be something to give a go.
Great, thanks, Lauren. We know it's such a big issue for so many people, regardless of treatment. So yeah, that's a really helpful overview. Thanks, Lauren. We're going to jump to the Q&A questions, if that's okay, just because there's lots in there and I'm conscious of time, so it'd be good to get through those, and then we can jump back to some of the more commonly asked questions. So the first one in the chat is around taking Creon with cold water. So what happens when you eat hot soup?
Yeah, good question. So enzymes should be swallowed with a cold drink, and that is because if enzymes get too hot, then they get denatured, meaning that they aren't able to work properly. So what we would suggest is that take your enzymes at the start of your soup. By the time your soup has kind of cooled enough in your mouth and down to your stomach, it wouldn't be hot enough to be able to damage those enzymes at that temperature.
That's great. Thanks, Rachel. So slightly more complex question around bile acid malabsorption. So some people might have heard of this referred to as BAM or BAD. So for those of us who have developed bile acid malabsorption as a result of the Whipple procedure, what are your thoughts about psyllium husk as well as a sequestrant? It seems to be a juggling act between Creon and polycevalum.
Yeah, it can be quite a juggle. So we do see BAM or bile acid diarrhea quite often in this cohort, alongside pancreatic exocrine insufficiency as well. So I do really feel for you in having to try and juggle both and manage timings of it all as well. With regards to psyllium husk, to be honest, I'm not sure of the evidence there with regards to that in terms of bile acid malabsorption and diarrhea. I'm not sure if you've heard anything, Rachel, at all.
No, so in terms of evidence, I don't know. I expect it would be limited whether you should or shouldn't use it. What I would be wary of is that with the psyllium husk being a fibre, that could impact on how well enzymes are absorbed. So
Yeah.
fiber is absolutely fine in a diet, and that is what we encourage people to have because it can help to keep our bowels healthy. It can help with our stools, making sure that we're going to the toilet regularly. But if somebody's eating lots and lots of fiber or having lots of fiber in things like psyllium husk, that can actually stop enzymes being absorbed properly. So then they're not going to work effectively, meaning then you're back in this really difficult cycle of malabsorption and getting weaker. So whilst I'm also not sure on the evidence of psyllium husk and bile acid malabsorption directly, I wouldn't be encouraging you to have lots of it because it would impact on the enzyme side of things.
Yeah. And we don't know how it will impact on your bowels either, you know, so fiber's a tricky one really, you know. We need it for good gut health, as Rachel said, but sometimes fiber can tip bowels, you know, into that sort of loose state and loose and frequent state, and for others it does the opposite. So yeah, it's difficult one.
Yeah.
Thank you. When choosing yogurts, etc., is it more beneficial to have full fat, as many now are no fat? Yes.
Yeah, no, many are low fat now. So we want the opposite really. So yeah, no, we would want full fat where possible. So often you can still find full fat in sort of the Greek sort of varieties, and also there are high protein yogurts available on the market now, which are really, really useful, and they do full fat options as well. Yeah.
Great, thanks, Lauren. Supplements, so supplements such as vitamin D and K2, K7, etc., are they okay to take?
So vitamin D, yes, absolutely. Vitamin D we would recommend for anybody, people with or without pancreatic cancer, because it's important for our bone health and making sure that our bones remain as strong as possible. So we'd recommend that usually for people from October through to April. With people who have malabsorption or risk of malabsorption, I would usually suggest taking all year round, just to kind of limit the risk of things like osteoporosis developing. Now, the other supplement, it was K2.
Sorry, Rachel. Yeah, it is K2, MK7.
So as far as I'm aware, I think it's a vitamin K supplement. I work in the hospital with people who are having surgery. So from my perspective, I wouldn't be encouraging somebody to take this if they were having surgery, because that could impact on things like their clotting, which we don't want to be affecting from a surgical point of view. Lauren, from an oncology point of view, what would your thoughts be on vitamin K supplementation?
So we don't tend to routinely. So in terms of oncology, we would always start a standard multivitamin and mineral, so a shop bought over-the-counter one, which would cover for all of your fat-soluble vitamins. So when I mean fat-soluble, I'm talking about vitamin D, vitamin K, vitamin A, vitamin E, for instance. We do, I mean, this isn't common practice everywhere, but we do check for vitamin and mineral deficiencies in our oncology centre. So if someone was low in vitamin K, then yes, we would look at supplementation, but we do need to be careful from the blood clotting side of things, as well, as Rachel said, but no, not routinely. I think if you're unsure, take the supplements that you're thinking about, or the names or the products, to your specialist centre for them to check them out, really. I guess some that are shop bought, might be quite high dose. So we just need to run things past the team.
Absolutely. Thanks, Lauren. This is a great question and a really important one as well. Is there an alternative to Creon? My father is Muslim and there is gelatin in it, so enzymes are pork based. He's refusing to eat it. He has stage 4 pancreatic cancer and is diabetic. His cancer is at the head of the pancreas and has also spread to his liver.
Yeah, it's a really good question, and this is something that we do come across often. it kind of puts people in a bit of an ethical dilemma when they choose not to have animal products as part of their diet. Now, there isn't an alternative enzyme that works effectively that does not have pork in it. So that's the answer to that question. So there wouldn't be anything else that your father could use. What we do when I have somebody who wants to discuss whether they would or would not take enzymes as part of their treatment is to speak with them quite openly about the fact that there's obviously pork in them. But as it is, it can be classed almost as like a life-saving medication. Because of that reason, it's usually allowed within Muslim law that they can take this medication. And usually speaking with a spiritual leader results in a discussion about whether that would ethically be appropriate for somebody. Now, it can be a real challenge coming to, I don't think there's a right answer for this question. But bear in mind that speaking with your spiritual leader might be a really helpful way to kind of discuss those concerns about taking those enzymes. But ultimately, because it is a medication, it is usually allowed. And it's this kind of toss up between ethically what's the right thing. If he's getting lots of unpleasant symptoms, side effects, whether it would be the best thing for him to take it to relieve that. If somebody is not having any side effects of not taking treatment, so if they're not having things like abdominal pain or lots of loose, greasy stools, then it might be that they choose not to take it because they're not feeling very unwell because they're not taking it. But some people really find that they get really quite challenging symptoms like that greasy, oily stools, and they kind of weigh up the pros and cons, and sometimes they do opt to take it.
Yeah, thanks, Rachel. Yeah, it's a challenge, isn't it? It's difficult.
Yeah.
Okay, so next question. What constitutes a snack? 1 or 2 biscuits, etc.?
Good question. I guess a snack varies for so many people, doesn't it? I had a man in clinic the other day that a snack was 4 rounds of bread, so 2 sandwiches, and then another lady where snacks 2 biscuits. So yeah, it's difficult. I mean, in our minds, I guess a snack would be something like a few biscuits, or something like a little pudding, a packet of crisps, that sort of thing. So that's where we come from when we talk about snacks. But it depends, doesn't it? It depends what your snack's made of, how fatty it is, what the portion size is like. Obviously, bigger portions, fattier foods are going to need more enzymes. So it might be that 1 or 2 capsules with your Creon or Nutrizyme isn't enough for that snack, and we need to increase or escalate the doses a little bit more. But yeah, it can vary from person to person.
Sorry, Lauren, I didn't mean to. Just going to say that's where it can be helpful in the beginning of taking enzymes to keep a diary, can't it? So that you can gauge, if you've had enough Creon, you can look back and say, oh, okay, well, I didn't have any side effects after having that.
Exactly. Good point. Yeah. So food diaries are really helpful for you as individuals, because you can look back at what you're eating and your doses of enzymes, but they're also really helpful for us as dietitians as well, because we can work out then, what constitutes a snack for you and what constitutes a meal. And again, that's part of our role in doing some digging there, isn't it?
Thanks, Lauren. Another great question. What can I eat to help develop muscles? I've lost 2.5 stone in weight and I have no strength.
Yeah, this is something that we see really, really frequently, and it's usually as a result of that quite rapid weight loss at some point, usually at the start of your, I guess, cancer diagnosis or journey. So the foods that are really, really helpful for building strength are food that has protein in it. And protein is almost like the building blocks to our muscle. And what we try and do is include these types of foods in at least 3 or 4 times a day over the course of the day, with an aim to try and build up strength. Now, protein is found in things like meat, fish, eggs, nuts, dairy foods, so things like milk, cheese, yogurt, nuts, and then beans and pulses, so things like kidney beans or chickpeas, things like hummus, baked beans. So we try and include these types of food, 3 or 4 times a day over the course of the day. And that will really help to start building up your strength. But what's really important alongside that is to make sure that you're doing a little bit of activity, a little bit of movement as well, because it's the movement in addition to the protein that helps to build your muscle strength back. And you will get there. It often takes longer to regain that strength than it took to lose it, which can be really quite difficult for lots of people.
Thanks, Rachel. If your cancer is at the stage where you are looking at just quality of life, so I assume by that no treatment, but looking at things like best supportive care or palliative care, is Creon still an option to relieve discomfort and pain?
Absolutely, yeah. So, you've hit the nail on the head there. In sort of the palliative setting and best supportive care setting, our main aims are obviously quality of life and making sure you feel as well as you can for as long as you can. So Creon and enzymes are still very important, particularly if you are experiencing gut symptoms, and symptoms of malabsorption, because they will help to relieve those sorts of symptoms, and help you feel better in yourself and weller in yourself. So yeah, they are.
Absolutely. Thanks, Lauren. Okay, next question. What foods can you eat and not have to take Creon or enzymes with?
Yeah, there's a few foods where you don't need to take enzymes. So namely, this would be things like small amounts of fruit or vegetables on their own. They don't need any enzymes to be absorbed. Also things like dried fruit or sugary sweets, so things like jelly babies or wine gums or sucky sweets, they don't usually need any Creon to be absorbed. What I tend to say to people is be aware of any extras you put with those foods. So for example, if you have a bowl of strawberries, you wouldn't need Creon. But if you have strawberries with cream, you would need some enzymes to help with the absorption of the cream, of the fat in that cream. Similarly, if you're having something like carrot sticks, you don't need enzymes. But if you have something like hummus alongside, you would need to take enzymes with that. So it's being aware of what you're adding to those types of food, which might need enzymes as well. What I also tend to say is these foods don't usually tend to be that nourishing. So fruit or veggies on their own or sugary sweets, they don't add much nutritionally. And it's being aware of whether that is part of your kind of aim, I guess dietetically, are you trying to build strength or are you focusing more on enjoyment? So if you're trying to build your strength, it might be that you opt for more nourishing foods. So things like milky puddings or things like cheese and crackers as snacks that do need enzymes, but are more nourishing and might help to build up your strength. Or if you are focusing a bit more on quality of life, if you're enjoying those kind of refreshing foods like things like fruit, then that would be your focus as well. So it's being aware of what your aim is overall.
Thank you. Okay, I'm diabetic and 7 weeks post-pancreatic surgery. Any thoughts on balancing diet for both conditions? Good question.
I'm happy to answer this one, Lauren.
Yeah. I think we see them both at your surgical, yeah.
Yeah. So diabetes develops as a result of something happening to your pancreas, so pancreatic cancer or a surgery. That's called type 3C diabetes. Now, there's other types of diabetes which people, I assume, will have heard of. So type 1 diabetes, and that's kind of characterized by not being able to make enough insulin. And then there's type 2 diabetes, which is often characterized by the body being more resistant to the insulin that's being made. Type 3C is probably most similar to type 1 in the sense that usually it would require some medication, and that would normally be in the form of insulin injections to help with blood sugar management. So what we're thinking about in terms of diabetes and diet is we need to think about what the priority is, first of all. So again, you know, are we focusing on trying to build strength, or are we focusing on kind of quality of life? And if we're building strength, then we, you know, what we tend to see is that people are wanting to kind of get some weight gain. What we don't want in this instance, again, is to restrict certain foods, because this can limit how well somebody is able to build their strength. So we need to think about this as a part of their kind of management and the balance of the diabetes and the pancreatic cancer. So certain foods affect blood sugars more than other foods, and carbohydrates are those types of foods that would affect your blood sugars. Now, carbohydrates, they can be split off into kind of two sections, I suppose. So there's the starchy types of carbohydrates, which would be things like potatoes, rice, noodles, naan, chapati, things like cereals, rice. So they're like your starchy kind of carbohydrates, and they don't affect your blood sugars quite as much as the other carbohydrates, which would be your, what we call them, free sugars, really what we call them. And free sugars are things that have sugars added to them. So table sugar in things like teas and coffees, or jams or honeys or marmalades, or foods that have sugar added into them, like things like sugary biscuits or cakes. So it's being aware of the types of foods that would affect your blood sugars and which food will affect your blood sugars less dramatically. Whereas starchy foods tend to kind of do this with your blood sugars, your free sugars will tend to do this with your sugar. So they jump up very quickly. We don't mind the gradual rise, but this big jump, that can be a little bit more challenging. So we want to avoid those where we can. So what we do is really we focus on foods that don't have as much of an impact on blood sugars. So things like protein foods that we talked about previously, they don't tend to affect your blood sugars quite as much. So snacking on things like cheese with crackers, for example, would be a good way of getting some nourishment in as a snack that wouldn't really affect your blood sugars that much. Or things like nuts, again, get some protein in, they don't really affect your blood sugars. So it's being aware of this foods that don't affect your blood sugars quite so much. Things like vegetables, again, don't affect your blood sugars, whereas fruit might do. But if you're having fruit, you know, we encourage it as part of a healthy diet, and have just one portion at a time. The sugar in fruit is kind of contained within the cells, so it takes a while for your body to be able to break it down and absorb it. So if you're having an orange, it doesn't affect your blood sugars quite as much as a glass of orange juice does. So having the whole fruit is important because it doesn't affect your blood sugars quite so much. And we also talk about things like portion sizes. We don't want people to feel that they're very restricted with what they can eat. So it's being aware of having a smaller portion of those foods and having them straight after a meal, for example, because then it gets mixed with everything else and doesn't affect your blood sugars quite so much. And then finally, what we'd do is we would work with the diabetes nurses to make sure that insulin doses are correct, because what we don't want to do is restrict someone's eating and ask them to pull back on their foods to manage their blood sugars. What we do is change their insulin doses to match the foods that they're eating.
Great. Thank you, Rachel. Two very difficult conditions to manage.
Yeah.
So that's really helpful. Thank you. Probably a question for you, Lauren. As chemo tends to play around with appetite, during and after chemo, your appetite comes back to help increase weight gain.
Sorry, Nicci, I missed the first part there. It cut off.
Okay. As chemo tends to play around with your appetite during treatment, do you find that after you finish chemo, your appetite comes back, which helps increase weight gain?
Yeah. So, chemo can really significantly impact on appetite, and that can be for a range of reasons, really. You know, there's lots of side effects that can come with chemotherapy, sort of, you know, fatigue and feeling very tired and therefore not wanting to eat or prepare meals as much. We've touched on sort of nausea and feeling sick and vomiting. Again, that can be a side effect. Taste changes is a big one as well. So things that, you know, things may not taste as they should. and may not be as enjoyable as they once were. So that can really impact on a person's sort of, desire to eat those foods as well. Sometimes we find that people struggle throughout their treatment chemo regime with appetite, whereas for others it sort of comes and goes really. So sometimes you'll get steroids prescribed as part of your chemo for a couple of days, and you might find during that time that you're absolutely ravenous and your appetite's really good, and then once those stop, that's where appetite starts to dwindle a little bit. So it can be a bit up and down really, depending on where you are in your chemo. Chemo obviously builds up, sort of the effects build up over time. So you might be absolutely fine with your appetite for, say, the first couple of cycles. And then as you get further on, that's where, appetite and eating starts to become more of an issue. Or it might just be a bit up and down throughout. But yeah, usually once chemo stopped and sort of side effects have worn off, we usually tend to see an improvement in eating at that point and appetite. Yeah.
Great. Thank you, Lauren. Are fermented foods and probiotics a no-no?
So from my side of things, so the kind of more surgery side of things, I would say that they're fine. If you're kind of recovered from your surgery, kind of longer term bowel health, they can be very helpful. I think we have to be aware of the impact that cancer treatments can have, and whether probiotics would be appropriate, which Lauren will answer now.
Usually through oncology treatments, we would say to avoid probiotics. Again, evidence I think is a bit sort of scarce in terms of treatments, but I think general consensus last time I looked at the evidence was that they need to be avoided, as we don't know how they interact with certain chemotherapy drugs, for instance. Probably avoid through any oncology treatment.
Thanks, Lauren. Okay. When can raw food be reintroduced? My mother still has diarrhea 3 months after surgery from raw food.
So I'm expecting raw food to be kind of things like fruits, vegetables, nuts, things like oats. That's what I'm taking as raw food. These are foods that we would usually encourage you to take fairly quickly after surgery, to be honest. Usually straight after surgery, they would be obviously cooked versions of these food. I don't know whether you're talking raw food more organically raw or actually uncooked foods, but 3 months following from surgery, these types of food would absolutely be appropriate. So they can definitely be included. If someone's having diarrhea, though, it would be as a question of, you taking the correct dose of enzymes? Are they being taken in the best way so they work effectively? Those would be the types of questions that I would be asking surrounding that.
Thanks, Rachel. Under which circumstances the replaced enzymes, so creon or Nutrizyme, if they stop working regardless of taking an increased dosage? So I guess that's if they're taking lots of enzymes and they're not seeing a solution to their symptom.
I think if you're increasing your enzymes and you're not seeing any sort of benefit to taking those increased doses of enzymes, we need to be looking maybe and thinking about alternative causes as to your sort of symptoms, really. So whether it's diarrhea or other sort of malabsorption signs. It could be, I'm not sure if you're having any treatment, but, are the bowel and sort of gut symptoms related to sort of a treatment that you're taking, whether that be chemo or another type of oncology treatment. It may be that we need to do further tests looking into sort of bile acid diarrhea or malabsorption, or sometimes bacterial overgrowth in the gut can be quite common as well. So I think, we probably need to do a little bit more digging, really, if you're not having the desired effect from increasing your doses. But as Rachel just mentioned in the last question as well, making sure that you're taking your enzymes correctly would be one step we would look at. As firstly, are you taking them at the right time? and the right quantities. Also, thinking about medications such as a proton pump inhibitor, so something like omeprazole or lansoprazole. So these help to sort of dampen down stomach acid in the gut and can help the enzymes work a little bit better. They give that more sort of favorable environment, if you like, for enzymes. So it might be that your doses of enzymes are right, but we need to start a medication like that so they work better.
Thanks, Lauren. My mum gets a lot of occasions where she gets loose watery stools, which can last numerous times for around an hour. She thinks it's the Creon doing this and has been advised to stop taking them by her oncologist. Will the Creon cause diarrhea, or is it a symptom of the cancer or chemo?
I'll let you take that one, Lauren.
Yeah, difficult one, isn't it? Again, I don't know the full picture, but it might be that the diarrhea is from not having adequate doses of pancreatic enzymes. So again, we might need to be looking at increasing or escalating doses there. It might be we need to look at timings that your mum's taking them. So sometimes people find they work better by staggering enzymes throughout food rather than taking them all at the beginning. Again, thinking about other medications, so what I've talked about just before about a proton pump inhibitor just to dampen down that stomach acid. So it might be that we need to think about getting one of those prescribed alongside your enzymes to make sure that environment's right for the enzymes to work properly. It might be worth, if you've not already had a stool sample, your mum's not had stool samples done, getting those done just to sort of rule out and check for any sort of infective causes, really. Chemo itself can cause diarrhea, so it's thinking about that as well, and whether there's any pattern. So it might be worth keeping a bit of a diarrhea symptom diary, particularly on sort of treatment, to look for any patterns, really, and also a food diary alongside as well.
I'm just conscious of time, so I'm going to put a couple of these questions together. I take Creon and lansoprazole. Are these okay to take together?
Yeah.
Great. Thank you. Is it okay to take omeprazole, which is a proton pump inhibitor? Is it okay to take it long term?
Yeah.
Right. And is there any maximum amount of Creon Nutrizyme? Is there any side effects of overdosing?
There's no upper limit for people who have pancreatic cancer. So we often say you can't overdose on enzymes. What we want to make sure is that you're taking them at the correct dose. So we kind of do that step up wise of increasing the dose to make sure that we are managing your symptoms effectively. And if somebody's taking too many, we wouldn't necessarily see many side effects, though some people may find that their stomach, they might get some abdominal pain maybe, or sometimes when they go to the toilet for a poo, they might find that it stings a little bit. That can be one of those side effects. So if you're getting any of those things, it's probably worth speaking to your specialist centre to see whether you need to reduce your dose a bit.
Great. Thanks, Rachel. So we've only got time for one last question. And it's about stents. So I have a stent. What kind of foods can I eat that are high in protein? I think we touched on this earlier.
Yeah. So with the stent, I think we just have to be aware of the types of food that people are eating, because we don't want anything to get stuck and block that stent. If you are kind of a few weeks post stent and you've got you're eating well, the protein foods that we would suggest would be things like softly cooked meats, things like mince would be fine. Fish will be a really nice source of protein for you. Things like eggs or cheese, again, would be a good source. Soft pulses, I think, would probably be fine. So things like baked beans would be a really nice option. The things that we'd be aware of from a protein point of view would maybe kind of very tough or gristly meat. Those would be things to maybe avoid, and also things that are very, very hard. So things like nuts would be ones to avoid. But having softly cooked meat as an alternative to those gristly meats, or having things like peanut butter as an alternative to nuts themselves, would be a good way of getting protein in, but with reducing the risk of that stent getting blocked.
That's great. And I think we've managed to get through all the questions that have come through this evening. It's a whistle-stop tour because it's such a huge subject. So thank you so much, Lauren and Rachel, for coming along this evening and talking to us. I think it's so invaluable, especially for those who don't have access to their own specialist dietetic support. So we really appreciate it. Thank you so much.
You're welcome. Thank you for having us.
Thank you for having us. Yeah, it's been good.
Thank you. And I hope everyone's found that really helpful. There's lots of nice comments there in the chat. So thank you for coming along. We do hold lots of these webinars, so keep an eye on our website for any upcoming sessions. We are going to just pop a feedback form in the chat. Please, if you can, take a couple of minutes just to fill that in, because it really helps us understand what you want to know more about and what we can do to shape our sessions for the future. And we will also send it round in an email as well, if you have time to do it now. But all that's left to say, another big thank you to Rachel and Lauren, and thank you all for coming along and taking your time this evening, and we hope to see you again soon.
Thank you.
Bye.
Thank you.
Bye.
Bye.